Cardiopulmonary resuscitation is a skill, and like any physical skill, the quality of it can vary greatly depending on things such as experience, practice, and physical ability. The quality of CPR matters. Higher quality CPR performance is directly related to an improved chance of survival. The better the CPR, the greater the odds for a successful outcome. Many hospital and EMS healthcare systems have already implemented high-performance CPR programs to develop and maintain the highest quality of CPR performance possible. Organizations with lay providers can also consider a high-performance approach. High-performance CPR begins with high-quality CPR skills. For compressions, compress the adult chest at least 2 inches. Compress at a rate of between 100 and 120 compressions per minute. Avoid leaning on the chest and allow it to fully recoil between compressions. And for rescue breaths, avoid excessive volume when providing them. The ability to perform perfect CPR skills is difficult for anyone. The best approach is to narrow the gap as much as possible between skill guidelines and actual ability. The only way to develop and maintain high-quality CPR skills is through ongoing practice. Brief yet frequent skills practice sessions can be an effective way to accomplish this. Using a CPR feedback device like the Loop learning system during practice also helps. A feedback device provides real-time feedback on the rate, depth, and timing of compressions. Users are able to make immediate adjustments to existing skills and develop a better feel for the improved performance.
Thank you for calling.
I'm all set up. Go ahead and send the page.
Yes, I can send that alert out right now.
High-quality skills are only part of high-performance CPR. Preparing how to manage cardiac arrest is also important. Realistic, scenario-based drills are an excellent way to prepare. Practice using a team approach. Orchestrating the actions, much like a pit crew in a car race, will improve efficiency and, most importantly, minimize interruptions. Understand the common roles in resuscitation.
The scene is safe.
Most importantly, the initial CPR provider who identifies cardiac arrest and immediately begins CPR.
Are you okay?
The person is unresponsive. The person is not breathing normally.
Brian, would you make sure that EMS is activated and the AED is on its way? 1, 2, 3, 4, 5, 6.
Once CPR has been started and others become available, the EMS activator will make sure EMS or an emergency action plan has been activated, an AED is brought to the location, and that ongoing communication with EMS continues. An AED operator attaches and operates an AED. When an AED arrives, it is immediately attached without interrupting CPR. An AED operator makes sure other team members are not in contact with the person being treated during AED analysis.
Do not touch the patient. Analyzing heart rhythm.
And when delivering a defibrillation
Press
shock.
the flashing shock button.
Clear.
Shock delivered. Begin CPR.
A team leader takes a more general
Take over
perspective
CPR on the next analysis. Okay.
to troubleshoot and improve overall team performance.
All the way up, all the way down. Good.
High-quality CPR is tiring for everyone. Switching CPR providers every few minutes needs to be a normal part of the approach. An identified CPR provider in waiting allows for a quick and smooth change in providers. Interruptions during CPR, especially to compressions, significantly decreases CPR quality. Team members need to be comfortable with any role. In many cases, team members may have to assume multiple roles. A realistic approach to practice is to continue without interruptions and allow mistakes to happen. After a drill is completed, A debriefing session lets team members reflect on how to improve things. The ability to integrate these improvements into an additional scenario can further improve long-term performance. High-performance CPR is a combination of high-quality CPR skills and an efficient team-based approach to resuscitation. Developing and maintaining the ability to deliver both of these through ongoing commitment and practice allows for the most effective approach to prepare for treating a cardiac arrest. Your employer may consider a high-performance CPR approach. Your willingness and commitment to participate will be essential to its success.